Hello everyone and welcome to this webinar on how to introduce Shockwave to clinic. I'm delighted to be joined once again by Geoff Twinning from Five Valleys Physio. I think second one, is it now, Geoff?
Number two, and a few informals.
The third one will follow, I'm sure. Geoff will do a little presentation just to go over the subject we're talking about, and then we'll have a bit of Q&A at the end. So anybody who has joined us live, the Q&A box down at the bottom, if you've been on webinars before, you should know the drill. For anybody who's watching this back on the recording, if you do have any questions at the end, just email it in to us, info@physiequip.com, and we'll get them answered as well. Otherwise, Geoff, I'll hand over to you and you can kick us off.
I was also thinking, Dom, if you get after each slide, if there's any particular questions, it might be pertinent to kind of answer some of those at the end of each slide. So if there's any questions popping up, then let me know and we'll look at them indirectly.
Absolutely.
Right, welcome guys. As Dom said, I'm Geoff, chartered physio, run my own practice in Stroud and Gloucester. We've got a pretty big team, around 16 therapists at the moment in our Stroud clinic and 8 in our Gloucester clinic. We treat lots of things, as most of you will do, from your chronic back pain sufferers to your degenerative tendons to your young children, and as well as your sporting population as well. I've been using Shockwave now for probably coming up 2 years, and we'll talk about Shockwave as a title, because I've got a little bee in my bonnet about Radial and focused, and that they should be sold as that rather than put under a blanket umbrella term. So we're going to have a look at not so much about the ins and outs of Shockwave, but more about how I've introduced it into the clinic to make it financially viable, as well as how do you look at buying, how do you look at risk in terms of the outgoing, and where do you sit within that pyramid of structure. So, welcome. The benefit I've also got, for the courtesy of Physiotherapist, is I also am a sonographer. So part of my diagnostics into Shockwave is I'm scanning, but we'll also talk about how that's not always necessary to help you all out. So if you get any questions as you go along, pop them in the chat box, and Dom can jump in at the end of each slide, or I'll give him a heads up to see if there's anything relevant to look at. So this isn't long and laborious. I want to make it quite succinct and specific, and not knowing what all of you guys are like in terms of like the business side of things. Don't worry if some of these you feel are basic, but I think sometimes, you know, I like the analogy of KISS, keep it simple, stupid, and that often goes a long way. So the main business questions: why should I, or why would I want to spend a lot of money on a major asset? And that is always at the top of your, I suppose, business plan. Do I need it? What population will service it? Can I actually repay it? Is it just a luxury item, or is it something that I want to make some money from? So the return of an investment from a business specific idea is what we're looking at. The main things obviously are, what are your risks financially? How are you going to fund it? And what are the benefits to the clinic, the client, and potentially your staff? From an accounting point of view as well, looking at whether or not it is something that will help you utilize profit so you pay less tax, but it does depend on your business structure or your entity. We used to be an LLP, and actually this was when we bought the products off of Dom, thinking, right, we've got a bit of money to spend, amazing, let's blow it and we'll save ourselves some tax. And because we're an LLP, we still had to pay tax on that. So it's useful to know what entity you've got, and chat with your accountant if you're looking at some of the bigger costs. Now we're a limited company, absolutely. If we spend the money on an item, we don't pay tax on that profit. So they're all things to look at from a business specific area. Have you got anything on that slide, Dom, at all?
No, nothing so far.
Happy. Thumbs up from everyone. Amazing. So I'm a bit of a maths geek, very much about numbers. Numbers don't lie. There's no grey. It's black and white. You know, if something makes you money, great. If something's making you a loss, great. You know, revenue is a bit of sanity, and it's all about profit when you're talking about business. So looking typically at your machine costs, are there any training costs involved? And what will that look at from a total expenditure point of view? Alongside that, there may also be some running costs. And depending on the brand of the machine, some companies who sell, there is a running cost to upgrade, to service, to change the heads. You know, some machines come with a specific number of shocks, and once those shocks are typically utilized and used, then sometimes you need a new therapy source. So we can talk about that a bit later as well. Also looking at how you're going to make any money from it. So what is your income from providing Shockwave? And that's where different places will have different models. How many sessions or blocks are you going to try and get that patient to commit to? And that is going to be research based. And then are there any other non-direct profit benefits? So are you getting referrals because you offer Shockwave and someone else doesn't? Obviously, Shockwave is not the sole thing to help a tendon. You know, what are your other therapy options? Rehab afterwards. And the big question is, do you need it to be profitable? If you've got money to burn, no, you don't. If you want to add it on as there's no extra cost to your treatment, it's clearly not going to be profitable. But you may get more treatments as a result of it. So you could argue that either way. And then something I'm a bit hot on is, you know, what's your USP? What puts you out there different to everybody else you're competing against? There's obviously a lot of therapists in many areas. I mean, we've got quite a few where I am in Stroud, from chiros to osteos to sports therapists. Some are, I'd say, small to medium clinics. Some are sole traders. And then we've got our own clinic, and we're probably one of the biggest, if not the biggest, in the county. So how are you going to stand above those? And that's, again, where I think you can have a look at, do you do focus Shockwave, which costs more, less people have it? All of the research really that's out there that is NICE approved is about focus Shockwave. It is not about Radial. And they are two different therapy sources. One is a radial wave, and one is an energy source penetrating to not do the kind of pro-inflammatory effect of irritate and aggravate, but to regenerate and to promote healing. Again, I don't want to delve too much into the finer points of Shockwave, but some of it we will touch upon. Any questions from there, Dom?
No, we'll keep going on that.
Oh, either a tough crowd or we're doing okay.
We'll go with the latter.
So the things I would consider when investing are, and having just finished multiple PG certs in different things, it is all about competency and proficiency. So can you prove competency in using something new? And alongside competency, how proficient are you in using it? So you might be able to inject, but how many injections have you done? And let's say, how many knees have you done, or how many shoulders have you done? And can you prove that you're, one, competent, and two, clinically proficient through experience and mentoring? So when we're talking about Shockwave, you know, I know from the guys at PhysiQuip, you know, if you buy a product on them, they'll heavily support you with, you know, how to set it up. They'll give you some training. You know, they've got online webinars. They've got an online portal for people who are on that, who can then access, you know, the relevant information that's up to date, look at research, and sometimes put people in contact with other people who've been using it a lot longer. So always think legal. Just because you've got a new toy, you've always got to think, right, well, if something goes wrong, or, if, you know, what is the injury risk? I think, you know, not so much with focus, but Radial can aggravate quite heavily. And you only want one person whose expectations aren't met, or maybe your expectations are misaligned with them, and they go, you've hurt me, I'm going to sue you. So you've always got to be looking to cover your back door and tick those boxes. So if anyone questions it, you can go bang, 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 here's my CPD, we're competent, we've done a framework, we've got clinic protocols in place. Just be super good. So training, again, looking at the recent research, Dom when he comes, and other of the team when they come and install, and they look at giving you an induction with the team or yourselves, they will go over what is currently out there. And like everything, everything comes in fads. I think Radial again is a different beast. I don't personally use it. That doesn't mean you shouldn't. Some people use a lot of it, again, cost-based. And is it better to offer something that can strongly aggravate and cause that pro-inflammatory effect versus not being able to offer it at all? So it depends on price point, it depends on what you're trying to offer, and it depends on, have 5 other people got that in your area? Great. Has anyone got a focused? Probably not. So always looking at what's about, do your market research, and then look at how can you train you and your staff around that. Dom came and trained us. We all got a certificate, amazing. Does that prove we're competent and proficient? No, but at least it ticks one of the boxes. And then we've gone on and done our own independent team training, looking at what else is out there, maybe a specific tendon or a specific issue, looking at feedback from ourselves in terms of the energy put in and the patient response from that. Machine cost is always a biggie. And this is really based on your clinic size. I think, maybe what your revenue size is, how big is your team? Do you want to make it something that maybe attracts staff over other clinics that maybe don't have it? And what is the cheapest machine you can buy, and what is, the most expensive, I suppose. Look at the demographic and then try and push yourselves where you can. Mental support, again, talking to people who already use it. We continually test ourselves against how we use it within our team. And if people aren't responding to it, normally it's either the diagnostic is wrong, or maybe the amount of energy put in is too much or too little, or maybe they haven't gone through the whole area as far enough. So user error can be an issue, and that's where diagnostics are really important, I think. Anything from there at all, Dom?
Nope.
Okay. So I know from some of the event questions, when you talk about how to incorporate or what are the clinical indications, obviously focused is NICE approved. There is strong evidence to suggest what it does, what are the physiological effects, and what tendons or what areas have strong clinical evidence. So with those, we're looking at patella tendon, we're looking at Achilles, we're looking at plantar fascia, we're looking at calcific supraspinatus. They're the main ones that have very, very strong evidence about how to reduce the pain state. Is the tendon reactive? If it's calcific, again, focus has been shown to break down some of that calcific debris. I routinely scan mine after they're a lot better to look at their image compared to pre-focused and post-focused. And that's really useful to look at how tendons change. And let's say an Achilles, we can often get over, let's say an 8-week period, quite a significant reduction in tendon size, as well as any calcific deposits that are there, which are not normally pain provoking, but are definitely symptoms of other stuff going on. And we can see those reduce as well. So with ours, we looked at, with a big team, the good thing with a big team is you potentially got more referrals. The more referrals you've got using your Radial or your focused, the potentially more use of that machine you're going to get, and then potentially more revenue you're going to get to pay the machine back. And then anything beyond that makes some actual hardcore profit. So again, looking at your return, what is your capacity to use it? Or are you just a sole trader, in which case you're limited just to what comes through the door just for your clinic list? So incorporating, we've got a massive sign in our waiting area. You'll be surprised how many patients come in and ask about it. So advertising, obviously you've got social media channels as well. So doing things on that, trying to link it with specific issues that you can relate to your population of people who may see that post. We always kind of plant the seed. So we do charge for Shockwave, and I'll come on to that shortly. But, you know, we always go on if money was no object, what would we do? And that is always my first line. Take the finance out of the equation. What is going to give you the best bang for buck and get you better, faster and quicker than if you do your silver or bronze approach? The patient doesn't have to decide, but you've planted the seed to grow. And if for whatever reason, after a few sessions, they're maybe not progressing as quickly as you want, you can just, you know, how do you feel about the thought of this? And they can make a decision. Now, the fish hook. Everyone loves a fish hook. Get them involved. So we offer a free session. So they pay for a block. We sell it as a block of 4 because clinically the evidence suggests 4 to 6 is on average what you will need to get a good effect for those areas that I discussed. I personally find we sell it as a block of 4 because it's the amount that we charge for that is a bit more, I think, accepting, and we give them a free session. So in effect, they get 5. So we've hit it in the middle. And then we say to them, obviously, if they need any more, or sometimes people like Shockwave just because it's a nice add-on and they get great tendon relief from it, they can just do a bolt on afterwards. But we always sell it as a block, never as an individual. Well, we'll do one here, we'll do one there, because we know that will be ineffective. If you Shockwave someone in terms of focused, they'll get a 2 or 3 day effect, and then it will peter off. And then it's important to try and hit the next session at that point, which for me is normally day 4, day 5, and then repeat. And by the time they've had number 3, they're 60, 70% better. And then we sometimes delay the 4th session, which will be the 5th, to allow a bit of start of rehab, and then to use that as a backup to enable the tendon to calm down, which starts to load it again. And in most cases, that is enough. So the question is, what do you charge? Well, I'll decide whether I tell you what I charge or not. Clinic policy, I think, you know, educate your team, make sure they're happy how to use it, because I know when we first got it, you know, the probe or the unit to replace it is $8,000. If you drop that, it's a very expensive day at the office. So we're all a bit tentative. And the more you use it, the more, you know, you're going to be competent with it. But making sure everyone is happy, you know, they're happy about when to do it. We also incentivize our staff. So if they sell a package, we pay them an amount of it, which I think as a business owner, your brain will always be on what's the best, what's the best. As an associate, their brain won't be on it. They're wired differently. And that's not to be disrespectful, but you're not worrying about the finance. You're not worrying about the rent. You're not worrying about how many patients have we got on this month. You're not worrying about, am I going to make any extra profit? What if I'm off sick for a month? All these things, insurance, couch rolls. I didn't realize a couch roll was 20 quid. You know, when we're doing probably 10 of them a day in our clinic. So all of these costs, associates don't always know about. They might think they've got an idea, but when you add it all up, you know, cost for sundries, massage cream, acupuncture needles, you know, the ultrasound gel to use on the focus Shockwave, they all have to be single use now. You can't just top the bottles up. It has to be a new bottle each time because of infection control. The costs are huge. So get the team on board, demonstrate the effectiveness of it, demonstrate why you would use it, give them the research, and then maybe 6 to 8 weeks, have a team chat. Well then guys, how many of you are using it? And those who aren't using it, why not? You know, how can we support you rather than why not point the finger? You know, it's your duty to train your team and to support them and to really make them better. And that's our focus in our clinic. It's never a point the finger. If there's an issue, it's up to us to make them better and support them in that process. Any questions?
Nope. Keep going.
Okay, so our big seller in our clinic, USP, is I'm pretty certain I'm the only physio in definitely Stroud, possibly within reason the county, within a single clinic who can scan and inject, and we're the only clinic who has focused shockwave. There are clinics and people have shockwave and they come in and say, oh, I've had shockwave already. I always question them. What did the probe look like? Were you told that it's shockwave or radial? If it's radial and it hasn't helped it, it starts to underpin why I don't use it. But it is a good tool. Not everyone can afford a focused shockwave machine. And a big part, which I'll skip back to, is shockwave radial or focused is not the fix. It deactivates or reduces the reactivity of a tendon pain, but you still need to load it. Your rehab is key. Your tissue length is key. All of your normal manual therapy things are key. This is just one of the prongs on the fork to get that person better quicker. I'm sure Dom will, with input in sports, if any of you watched the European Championships in football last year, where the England team got to the final, they were the only team to have a full squad. And the reason being, they had a focused shockwave machine. So they were treating people for not just injury, but just tissue soreness. And with tournament football, very common that players break down because they're playing so often, they're training, and they've got multiple games, every second, third day. So that was a massive part in their utilization to keep their team fit. So ultrasound, if you've got it, it's a great tool because you can dictate the depth. If I said to you, how many of you know how deep the anterior aspect of the Achilles is, I'd be interested to know people's thoughts. But it's typically about 10 mil, give or take. If you've got a big fat tendinopathy, then it could be 15 mil. So knowing that means that when you're using, especially focused, you can target the depth of the tissue. And that is one big thing over focus that radial doesn't have. Radial gets, a lot of the energy gets absorbed by the skin, and then it becomes very quickly exponentially less as it goes through the depth. So one of the limits for radial is its depth. One of the big things with focused is you can get, the one I've got goes up to 6 centimeters. So I can pretty much treat anything that I need peripherally on the body. But do you need it? No. Will you be better having it? Yes. But you don't need it. I mean, we're all pretty good at going, you've got an Achilles tendinopathy, or, your plantar fascia, again, tendinopathic. So you don't need it. But I suppose the question is, for the people who don't get better, why is it? Is it because there's a plantar fascia tear that you've missed because you just think it's a, tendinopathy type injury, and actually they've got an avulsion? The same with the Achilles. Have they got calcific deposits? Have they got retrocalcaneal bursitis, which is normally a symptom of, but not a primary? All these things you don't always know, but we've had plenty of time treating people without ultrasound. So definitely not needed. It's definitely a big Brucey bonus if you've got it. But the main thing is be as accurate with your diagnostic as possible. And if you can do that, you can then portray that confidence to the patient. I always want to guarantee that if they're paying £200 odd on top of any consultation costs, that I'm going to make them better. I think I just have guilt, which is my downfall probably as a business owner, because I want to help people more so than probably I charge them. But if someone spends £200 and the consult fee, so let's say 300 odd, and they're not better, they're going to start complaining. So I think avoidance of that is key. Don't get lazy, keep your hands on. I'm a very big advocate of manual therapy. I know there's a lot of people out there who are like, you don't need it, but I would argue they're very poor private practitioners if they're not hands-on therapists. We know the research on massage is low, it works. So you can be evidence driven or you can be practically driven with an evidence backup. I am that one. You're not always a good physio if you know the evidence, put it that way. So the depth is really important when you're treating a problem. Know your rough depth. You can take a rough approximate, and if you're in the right spot, especially with focused, you'll get a response. With the radial, it just hurts. So you don't get too much of a diagnostic, but with the focused, you're going over an area, normal tissue, you don't have a response typically. With an area that's inflamed or a tendon that's sore, or, neovascularization, the patient will feel discomfort or an ache in the area. So the focus is a fantastic tool for a diagnostic as well as treatment. So radial versus focused, they are different, completely different energy sources, different effects physiologically, but I think unfortunately everything is being put under the one canopy of Shockwave. That's probably a different webinar in itself. They both have benefits, some more superficial, some deeper, some pro-inflammatory, some regenerative, but they are different, and they both have places in a treatment. The question is, what do you want to deliver? Or do you deliver both? Some people do both. For my evidence reading, and you're looking at the NICE approved, focused is what is NICE approved, not radial. So if you're private practice, the likes of Bupa, AXA, Aviva will cover it on top of physiotherapy. So when you're looking at revenue streams, they will pay you an amount for either a course of Shockwave or individual amounts for each use of Shockwave. And that doesn't matter whether it's radial or focused, so worth bearing in mind, on top of their physio. And again, you've got a revenue stream there. Let's say a Bupa patient, you want to do Shockwave, they've been given 5 physio sessions, you just tell them you want to do Shockwave, and they authorize it, and then you charge them for the Shockwave and the physio. So from a revenue perspective, that can be quite good, as well as they're getting better treatment.
Geoff, question.
Yes.
Do you, from James Power, hi James, how are you doing? All right. Do you have to register Shockwave with insurance companies?
Good question. I would say yes. So your insurance only covers you to what you disclose to the insurer. So if you're delivering Shockwave and then someone sues you, not that I've really ever come across anything, but if you've got like let's say you've got an avulsion, typically if you focus that, it will hurt. So bone tends to be much more sensitive, but would never leave any lasting issues. But it's probably a combination of manual, irritating, maybe another therapy source aggravating, but always looking at liability, you're only covered by what's on your policy. So common sense, I would say yes, or at least raise the question with them.
I was going to say, because obviously we're talking that personal insurance, like the public liability insurance and things, and obviously there's the Bupa, AXA and everything else.
So you've got your CSP, so that is your personal liability. But if you're working under a business, whether that's your own business as a sole practitioner, let's say Jimmy Blogs Physiotherapy, and it's only you in it, they will sue you as a practitioner and the business and anyone who's referred and been implicit in that as well. So your CSP covers you as a person, and you'll need business insurance to cover the business name. So your CSP covers you.
Because we work with BASRAT, I always say work with, we know the guys at BASRAT, and said it kind of comes under the electrotherapy umbrella, but it's certainly worth just speaking to them and letting them know.
Yeah. Yeah. I mean, what is electrotherapy? Something with a plug.
You plug it in, or it runs on electricity.
Yeah.
It's always worth, like, obviously, like you mentioned, we always provide certificates anyway, so it's always worth doing.
So your CSP is competency and proficiency.
Yeah.
So have you got evidence of training? Yes, tick. And do you do some regular CPD? Yes, tick. You're allowed to practice under under your CSP as long as you're appropriately trained. Same with injection therapy, same with diagnostic scanning. There's certain exclusions, like spinal injections aren't covered under your CSP. But if you're, chiro, sports therapy, check your own independent policy. If they say yes, I would get them to document it. Electrotherapy, including Shockwave.
Yeah.
Because never trust anyone. If you get sued and they then turn around and go, well, it's not on the policy, we said electrotherapy, but we disagree.
Yeah.
You're struggling.
What about just on the insurance side, but for the Bupa and Access, how did you approach them?
So we're covered as a clinic. So anyone who works in our clinic is covered by all of those insurers. Mm-hmm. I think nowadays it's harder to get individually recognised because they try and condense the providers in an area. So let's say Stroud, they're not going to want 20 providers. They're going to want maybe 2 or 3. And that's where maybe if you're a new person setting up a business or you're working from home and you want to register, I can't tell you if they will, but they may or may not let you do that. So you obviously need to be registered, and part of that registration process is an audit to make sure you tick all their boxes so their clients know what they're getting. But if you are already, and this is more for physio and probably chiro osteo, if you're already registered, then Shockwave is covered. And they'll just, if you ask them for the codes, then, when a patient goes back to them and says, yeah, I've been offered Shockwave, this is the code, so it links to a shoulder or a knee, you can use that, and they'll go, yes, this is our pre-agreed amount that we'll pay you, or this is the amount we'll pay you per session of Shockwave. Answer everything on that front?
Yeah.
Going back to the Radial, and Don will probably know more than this than me, is the head is the head. There's would you agree on that one? There are different heads, aren't there, with the Radial?
Yeah, there's different transmitters on the end, which can determine how far and potentially how deep it goes. But essentially, they've all got a projectile inside a chamber that hit off the end. Some do it by compressed air, some do it by electromagnetic, but they all send a bullet or projectile backwards and forwards.
So with the focused, we can put different attachments on, which push the energy source away from the skin. So in effect makes it shallower. So if you had no attachment, it would go, for ours, would go 6 centimeters deep. So if we put a 10 mil attachment on, then it will go 5, blah, blah, blah. So we can target an area very specifically. We've got a pinpoint one. So it's like, I always describe it as like coloring in a small area. And normally I'll have like a rectangle around, let's say a plantar fascia. I'll go to the top end, just below, just kind of back end of Achilles. And then I'll go down into the quadratus muscle of the forefoot, plantar area of the foot. So I go beyond the point of where the person complains of the pain, because you'll have multiple sources of pain. Yes, the plantar fascia is sore. Yes, the tissue around it's sore. And clearly, if that's been overloaded for months, the soft tissue underneath that will also be sore. So by having a bigger area and trying to colour it in with the pinpoint source, you generally get a bigger impact. With the linear one, again, probably better for wider areas. So let's say your periostitis in your shins, where you've got a length and you want a very focused point of energy, but in a long line rather than in a point that kind of comes out like a dartboard. So different ways of how you can do it with different sources, or you can use both. Ours is pinpoint only, and I've looked at linear, and we will at some point probably get a linear. But at the moment, pinpoint, great for Achilles, great for plantar fascias. We use it on medial degenerative knees. There's some evidence that, meniscal tears can heal. For those of you who may or may not know, within a meniscus, the inner third is vascular. The middle third has some vascularity, and the outer third has 0. And there has been some evidence that with Shockwave that small tears have then been shown to heal post MRI after treatment. So we use it for degenerative tears just to reduce the pain. We can hit let's say the medial femoral condyle, but we can also hit the tibial plateau, and we're looking for a pain response. And we've had some good results with that. So lots of ways that you can sometimes look outside the box you've got your research and your evidence, but also the only way evidence grows is by, you know, stressing the boundaries of that. Right. So the usual publicity. There are, and actually this goes on to one of the questions we had on here. So types of machines and quality. I'll just go through some of these. So there are different machines out there. There are different energy sources in terms of how the energy is produced. Ours from Dom is a piezo wave. So that produces a very focal point of energy. And being focused, it has all the physiological effects of regenerative properties. So it reduces substance P, which is your pain chemical that tells your brain. It causes cellular regeneration. It causes stem cell regeneration. It can help break down calcific deposits. You know, the list goes on. It's great for neovascularization in an Achilles where that's also causing pain. And Radial is a bit more like the old deep transverse frictions. You know, you're trying to aggravate an area, get it out of that chronic pain pathway, stimulate a bit of bleeding, and then the inflammatory effect and the healing that goes with it. But we looked at a few, and some I felt looked a bit archaic. They didn't look like 2023 models when, if you're spending a lot of money, you want it to look up to date. And the ones from PhysiQuip I thought looked very good. So looks are everything sometimes. And then in terms of, yeah, sorry, Dom. And then in terms of, you know, the probe, they are quite delicate. You do need to look after them. It's very soft metal on it. So, you know, you've got to be very anal about cleaning it and making sure no one's digging their nail in. And the good thing with the PhysiQuip ones as well is that, was it 15 million on the piezo wave?
7.5 per therapy source. So if you got 2 therapy sources, it would be 50.
Yeah. So when you look at buying a product, look at the therapy source. How many shocks will it provide before it's known to maybe not run out, but become less effective? So some are 1 million. I won't name names. As Dom said, his one was 7.5. So it's far greater. And the more shocks you've got available, then the more potential revenue you're going to get out of it before you then got to pay for a new energy source. So if we need a new head, that's 8 grand. And then that starts back in the bucket of, well, I need to pay that off. So we've actually paid our machine off within, I think, a year. So full paid, you know, we paid for it up front and fully paid it off in a year. So everything now that we use it for is all complete profit. I don't know how many shops we've used on it. Be interesting to check it. But that will give us an idea then about potentially when are we going to have to renew the energy source. Price point is always important, always worth a haggle. So,
no, it's not. No,
you know, no, it's not. No. But, you know, as anyone, hunt around, see what you find. Cheap isn't always best. And that's kind of how I looked at when I was looking at, do I do Radial? Do I do focused? Do I get a good product but has less evidence backing it? Or do I pay more and get something which is gold standard, that has that nice approved stamp, that increases my risk financially, but you can plan for it and you can potentially then charge more for it. PhysiKit's team with support are always fantastic. All of the guys are really outgoing, always very helpful, from, you know, the engineer who will come out and set you up, Andy, to Dom and other Andy and all the other people there as well. You know, you won't find a better team. Training as well, like I say, they've got an online portal, so that is growing in volume and gives you a point of contact for looking at evidence and looking at training videos. And if you want to go back and look at something, you know, you've always got that there. You're not kind of left out in the dark. As I said, the machine quality and the professionalism of them all are all fantastic. So from that point, a few other bits I will, so let's go back to this a minute, go over. So how often do you apply it? We do ours every 4th day. The only time I might go 5 days if it's really angry, like a really angry, you know, 8 out of 10 pain Achilles. But we tend to hit 4th day. So our whole team service that So my list is typically fully booked 3 weeks ahead. And if I've got someone who I want Shockwave, then I'll use my team to deliver that either solely as a Shockwave session, so a 15-minute session. We're very upfront and transparent. This is only for Shockwave. You shock it, they're out the door, and they just pay for that session. If they're still having some hands-on therapy, then we'll do a half-hour session, and within that, we'll deliver the Shockwave as well. You know, for one area, let's say it's 5 minutes. If someone's got multiple areas, you charge it per the area, because every shock you use is costing you money. So think about that when you're looking at the business plan. You know, in London, Focus Shockwave is charged out massive money, £150 plus per use. I would prefer to have it used by more people as a volume than less people and charging more. If you've got so many people you can't service them, whack your costs up. But as a new item within your clinic, you want as many people to potentially use that as possible. So they'll get referrals, they'll send referrals, they may even use it again for another problem. But really try and make it as wide market as you can. And the only way you're going to do that is hit your price point right. And I won't tell you what necessarily we charge, but everyone's got different demographics, you know, everyone's therapy costs. So what I charge for half an hour me could be £30 less than the next person up north. So, you know, bear that in mind, do your research, maybe look at other websites, see what they charge, and then think about your demographic, go, right, well, what sort of figure do I think I can get out of someone that's a fair price, that is going to enable me to deliver 4 sessions? You may or may not want to give them the freebie like I do. But often that's the thing. If they walk in 7 out of 10 pain and they walk out with 2 out of 10, that's your fish hook. And then they'll often go away and they'll go, yes, I want to start. When can I do it? So really important on that front.
I think, sorry to add to that, Geoff, because it's sometimes a question that we get a lot, and I get a lot of work with a lot of clinics in terms of where to price things, and always look at what the current hourly rate is and how your price compares to that. And this is generally speaking, as you say, some people will charge a premium on the service, and some demographics like that premium element. But I like to sort of look at, if you're doing £60 an hour, how can introducing Shockwave increase your £60 an hour to £80 an hour, £90 an hour, £120 an hour? How can it do that? And I think trying to keep a price within shot of what you currently charge, so it's not way outside. And I'll give you the example, because we used to have our own clinic, is we were charging £75 for half an hour, but our hourly rate was about 50, 55. So our uptake wasn't that good. Once we dropped it down to about £40, about a 25-minute session, the uptake went up, because all of a sudden it was perceived to be less money. They're already used to paying 50, 55 quid. Now they're paying less, but they're still getting a premium element. So there's a few different models that work, and we'll probably touch on it in a sec as well.
But definitely the, you know, we've got the block sale at the start. That's really important. You know, they need to invest in that. There's no point having 2. And then they go, oh, it's not working. Well, it's not working because you've not had a treatment course. Yeah. So we only sell it as a block of 4 at the start. And it's either as part of a normal session, or they come in and they just pay. They pay for the consultation, really important, because you've got to pay your staff. So that we do that as a sessional price, and the Shockwave is a bolt-on. No different than if you go and see a consultant and he says, I want to inject you. He will charge you for the consult, and he will charge you for the injection. Some people say, well, why have you split it into 2? Well, it's important because it may be you don't pay your staff more for delivering Shockwave. It's just a perk of working in your clinic. You've got access to good kit, use it. And you're still going to earn your same amount, but you're going to get your patients better, faster, better PR, more patients in response to that. So we started off with that. They didn't earn any extra. It's just a good perk. And now we've paid the machine off. We give them, it's about 15% of that block booking. So they're increasing their earning potential, although we've had all the risk. But that's the dilemma as an owner. You're always looking at, how can I keep my paid staff going well? How can I incentivize them to do stuff? But at the same time, you've got to make money. Don't be shy and going, this is about making some profit. because if you're off sick for a month and you've got no profit, you've got no business. But yeah, the price point, like Dom said, I think is, you know, you just need to know what it would charge out at.
It's difficult, isn't it? Because you don't want to charge it too low and devalue it. Don't want to charge it too high and put people off. And it's trying to find out, does a block booking work for you? Does adding it on as a supplement work? I know there's a clinic that does like a Shockwave clinic where they're just like every 20 minutes, but the patients are in and out. And that works for them, but they charge like quite a low rate on it, but they're just sheer volume. There's all sorts of ways. And I think that's obviously, well, you know, we've had conversations before, I've had plenty of conversations. We can kind of, people can bounce ideas off of us because there's 40, 50 clinics in the same position, and there's 4 or 5 models that work. With Radial or focused, I think that's one of the things I kind of want to jump in and say is that there are 3, 4, 5 models that I know work. So it's just finding the right one that fits for you. And like you say, it's just then how to introduce it to the patient and becoming competent. I mean, would you say that once you're competent and feel comfortable using the system, then the in inverted commas, the sell to the patient is a lot easier because you're bought.
If you know the evidence, like everything, you know, why would you why would you rehab? Why do you need to load something? You know the evidence. So, you know, I think as long as you can, and that's why it's good doing that little goodwill thing, because patients won't have the knowledge unless they're actively searching for Shockwave. And some people will come in and go, oh yeah, I want Shockwave. You might not agree with it. You might say, actually, at the moment, I don't think it's appropriate. So it's got to work both ways. But yes, I think the main thing is you're reducing pain. Really important. It's about pain. If they're not in pain, you can load them. Loading is going to be the fix. And I always tell the patients this is not the fix. This is just about making you much more comfortable, helping the tendon regenerate so that when we load it, it's going to adapt and it's going to be better. There will be some that don't get better. Either their tendon is absolutely shot. It is like a bit of moldy rope, and it doesn't matter how much you shock it, it needs something else. You know, and we've had a few of those, and we've gone in and literally needled the tendon to make it bleed, to enable what would be empty holes in the tendon to fill and scar. But I'd say that 90%, if you get your diagnostic right, Shockwave is fantastic. Radial or focused, absolutely. But I think the bolt-on is important. As a business model, I wouldn't blend it, because how do you know what you're making from it? If you want to go back in a year and go, how much money did I make? Or not even make, how much money did I generate? Then you know if you've paid your machine off or not. Then you know, okay, well, I paid 50% off. That's pretty good. It hasn't cost me any money. And I know in another year, I'm going to pay the rest of it off. And then after that, everything is liquid profit. So ours goes down on our diary as Shockwave. So they're booked in for a session, and the second column is Shockwave. So that way we can literally go, you know, system, tell me what it's generated. And then every month it tells us how many block bookings we've made. And then from that, I obviously go back and we do a little competition, right? Who sold the most this month? And then they're going to get paid for it as well. So it's a bonus.
Just from a clinical perspective, Geoff, I had a question come in about using Shockwave for apophysitis, so Osgood-Schlatter's disease. It is relatively contraindicated, or it is contraindicated in the NHS, is what Andrew's saying. I think now it's widely relatively a contraindication. Do you use it? Have you used it on Osgood, Severs, anything like that?
Obviously, in terms of, again, pain source is really important. So I don't use it in under 18s for the reason of, you know, the evidence is on adult populations for degenerative tendons. You can use it for fractures, which can be really good. But I think once you start talking about under 18s, you've got to be careful. I think for the kind of Osgood-Schlatter's, would I use it? No, because the pathophysiology, it's growth related, overload, and that's still going to happen if you shockwave it. So
shockwave is a load, isn't it? So it's
you know,
What you say this, and I think this is again kind of touched on. I've seen now 3 papers on using it for Osgoods in Germany. I think 2 in Germany and 1 in Italy. I think they've shown no adverse effects. However,
Radial
as a
focused.
representative, focused. Oh no, sorry. I think 1 was Radial. Actually, I think 1 was Radial. So I know there are some people who are using it, and it comes down to clinical judgment and how that patient's presenting. We're always, I think, absolutely agree with you, Geoff, in terms of the presentation. When they're under 18, it's looking at musculoskeletal maturity, because you can have a 15-year-old who looks like a 25-year-old, and vice versa. You can have a 15-year-old that looks like they're 13 and they haven't quite had their growth spurt yet. So I think that's got an aspect to play. It's really delivering Shockwave directly over the growth plate, which is the sort of the biggie, the kind of unsure aspect. But yeah, if you want to have a look, just type in Shockwave Osgood Slatters into Google Scholar. I think there's 2 or 3 papers that pop up into there, and you can see what they've done. So they're initial ones, but at the moment, because it's relatively contraindicated, we just say, look, best to avoid. But watch the space, because maybe in the next few years it could be coming off the list. I don't know. So
yeah, like anything, if in doubt, don't do it.
Yeah.
You know, because you're opening the floodgates if you're not careful. Just how many sessions we've done, marketing. Yeah, any other questions from your end, Dom? I think I've done those from the email.
Cool. No, I mean, I've got, like, just coming back to the business side of things. Obviously, we talked a little bit clinically and that side of things as well. Obviously, if anybody wants to know more about the differences in Shockwave, focused, radial, we do have other content and resource around that. Obviously, you're a massive advocate for focused, and we've recently taken on radial because there is a market there, particularly
massive market.
And like you say, the price points are very different. We get quite a few inquiries saying, "Love a focused Shockwave." We say the price, you know, we start at 22,000. So I think it's the most affordable focused Shockwave on the market. And if you're not prepared for that, it's like a whoa.
Plus
like, so radial, it can be a really good start place, can radial, and build up that Shockwave business for you to move to the step, or to focus Shockwave. One of the questions I always ask people from my perspective is if you're comfortable parting with 25,000 pounds in cash, whether it's up front or popping it on a lease might be better because it's better for cash flow. Potentially you can spread it out. If you're comfortable with that, go for focused. If you're not comfortable with that and you want to build a business, then, you know, £6,000, £6,500 radial Shockwave, it's not as big of an overhead, and especially for those single practitioners as well, for very many, you know, that's might be a good option for you. In terms of like the free session, Geoff, because I know it's something we actually spoke about, is what was the biggest justification and how did you calculate the feasibility of it?
So the cost per use, so if we deliver a Shockwave session at 2,000 shocks, then we know that was going to cost us about a tenner. So spend a tenner to make 200.
Yeah.
So it does dilute it a bit, but again, are you better off having 10 block bookings in a month or 2? So it is one of those things, and once someone's used it, you don't need to give them the goodwill again, you know. Or if someone's got, and you'll see a lot of people with bilateral Achilles. So I'll often say, look, okay, if you want it on both, but we have to charge it per area. So let's say ours is £200 for a block of 4. You pay for the consultation as well. And sometimes patients struggle with that concept, but I try and sell it like the consultant and the injection. And you're paying for 2 things. One is for the expert time of the therapist, and 2 is for the bolt-on for the Shockwave. So I think so a recent lady we had, she had both Achilles. I said, look, let's do one first. Let's just make sure we're going to be positive, it's going to affect as we hope it will do. And she did amazing. 2 weeks, she was pain-free, loading her off she trots, and then she was like, right, I want my other one done. So I did discount the second one.
Yeah.
So rather than 200, I charged her 150. She's still paying all the consultation costs as well. She feels she's got a good deal. We're still paying for the product, maybe not as profitable per block of 4 than the 200, but it's still a profit. So you just got to look at it, lots of small profits make big profit. And, like treatment costs, we're a volume industry. It's not about one session, it's about a block of sessions, get them better. They'll come back as a returning patient. They'll tell all their friends and family, and the balloon just keeps on growing. And I think Shockwave, you need to pitch it somewhere to kind of start the balloon pump.
That's a nice analogy. You got some fun analogies. I've never heard somebody call a tendon a mouldy rope before, by the way.
The other thing we did when you came in, Dom, was we actually handpicked a few patients.
Yes,
So we use them to say, right, come in. We've got this new product. I think it'd be amazing for yours. We're struggling. It's not breaking the pattern. Like, let us treat you as a training. And if you want to do it, we'll give you an intro price of X amount.
Yeah.
And actually, we picked up a few patients just from that.
I think it's just being a little bit innovative. And I know there's, obviously, from our sense of business, I know we've got to look at investment versus return as well. And it's some of the financial expenditures for our end are quite large, and you've got to understand what's the return for it. And sometimes you do have to make that investment for a long term. It's not necessarily what's it going to give you back this afternoon, next week, next month. It's what's this going to do in a year, 2 years time. And I think I understand that if somebody's parting with, from Focus Shockwave perspective, 20,000, 22,000 plus VAT, 25. Is you wanting to make that money back as quickly as you possibly can. However, it's probably like diagnostic ultrasound. It's a long-term thing. If you're going to be if you're going to be using Focus Shockwave, I'd like to think that people will be using it for 5, 8, 10 years. So once you kind of spread it all out, absolutely you want to make your money back. If you can make it back inside a year, brilliant. Because then every year on that is better. But I think it's trying to get, do you think it's like trying to get past the short term and look at the mid to long term as well as to where you're going in terms of your return on investment?
So I think good business people, physio, whatever, but it's about risk, and, even with me and my co-director, because I've been doing it so much longer in terms of running a business, and we've moved the clinic 4 times and we've spent like 6 figures on renovation costs. For me, £20,000 is much less of a risk than for my business partner. And so I think it's all about your exposure. So I always think, well, what's the worst case scenario? Well, worst case, you could sell the machine, still going to have a warranty. Okay, you won't get all your money back, but you'd definitely find someone who would be keen to buy a second, and it'll still be covered. So there are probably very few machines out there secondhand. So again, if you come back to you, Dom, and go, well, I've got this machine, I can't get the use out of it. What sort of price point can we get for it? You're not going to be a million miles away, but let's say it's 26 grand. You can get an unsecured loan personally for 26 grand you could do it over 5 years or 10 years, and you can get that repayment down to 300 quid a month. You in effect need to sell 1 block of 4 once a month to cover your costs. So that's how I looked at it. Yeah. Really. Luckily we'd saved, and we didn't need to borrow it, really. That's money we didn't pay ourselves, so that was the hit, but it was paid for.
Yeah.
But then we bought other things where we've had to use a loan. But I've just done that. I go, right, the cost of the loan is 300 quid a month. That's a pretty low risk. If I can do 2 scans or, 2 Shockwave blocks, but it's paid for the loan, and the loan's paid for the equipment, and it's an asset under your account. So, it's just looking at risk. What's the worst that can happen?
And I think I think kind of touched on some clinicians, and I know myself, it took a while to get used to kind of asking people for money, for me trying to make them better, because at the end of the day, you want to make people feel better. And charging for it can be quite alien, especially in this country when we were driven by the NHS. I remember we've got colleagues in the States. There's a mindset difference. Like the States, they use healthcare. What was it? I think we use healthcare, and they we're users. I can't remember what the thing was, but anyway, there's a different mindset because they're constantly paying for it. So there's a difference in expectation. But in terms of Are there any suggestions of how you can change people's mindsets in terms of like looking at it from a more business perspective? Are there any books or anything that you've kind of found that has been quite interesting, or is it something that's come quite naturally to you?
I think the biggest thing is education. So that patient needs to understand fully what are the benefits. You know, if they've already seen someone else, the hook's there. Well, you're here because they've not got you better. I've got this, and I can pretty much guarantee, and that is the big thing with it. If you get your diagnostic right, you can pretty much guarantee that you'll make them significantly better. So again, it's going back to knowing the evidence. You know, we've got an information sheet. You know, I might say a bit about it, and then I say, look, I'll email the information sheet, have a read about it. It's got all the information on it. It's got all the research. It's got the costs. You don't even have to talk about the costs then. And you've dropped the seed. You know, I always say, look, this isn't something I do from session one unless the patient wants it. So it's always about that shared decision making. Give them the information. These are your options. We can do physio. We can do, and that will include X, Y, and Z. We can do physio. And if you want to really accelerate this, we can shock it. And these are the relative costs. If we go down the physio route, it might take 4 extra sessions to get you to a level where we can load it. Or if we're happy with the diagnostic, we can hit that now, and in 2 weeks you're loading it and you're 80% out of pain.
Yeah.
But I think we feel guilty asking, and I feel guilty asking. So I always say, go to reception. They'll tell you.
So that's the one thing we missed at our clinic when we had it. It was I was like, I really want a receptionist, because I don't like, oh yeah, do you treatment? You go, I'll have some. You wish, especially at the end of it, they're like, oh, it kind of feels better. It's I'm like, oh. So. But no, I mean, one of the questions I had actually was a couple of weeks back, was I know what my answer is, but in your opinion, do you think Shockwave is a bit of a fad, or it will have the same kind of life cycle like therapeutic ultrasound, how it kind of came up into prominence and has dropped away, same with interferential, come to promise, dropped away? Or do you think Shockwave is here to stay? Or do you think it will just come and go?
Focus Shockwave, because again, it's evidence. The evidence is all about focus shockwave. There are new bits of evidence about radial, but if the majority of the energy is absorbed at skin level, you know, there's some dollar cast stuff now that is showing that there is still some good energy lower, but it depends on how much you use it and how much you're an advocate for it. You'll probably search for more info. Because I don't use it, you know, do deep transverse frictions work? Yes, they do. So I think the problem with physio is we're constantly looking, or therapy, I should say, is we're constantly looking for that new thing. But actually, the old things work. You know, soft tissue work, it works. Joint mobilizations, anyone who says you can't feel a facet joint or you can't feel a transverse process, I don't care what the evidence says, I can feel it. Can you feel psoas? Distal tendon? Yes, I can, because I can scan it and I can demonstrate that there it is and I can prod it. There'll be a lot of people out there say you can't touch distal psoas. So the problem is you've got evidence and you've got practice. They are different. They do need to amalgamate into one. But what tells you how good a therapist you are is how many of your patients do you get better. That's key. If you're a hands-off therapist, like the NHS unfortunately now is, and this is why all these patients are now flooding private practice. Yes, we don't want reliance, but private practice has a different benefit. You know, it is about healthcare. It is about, I'm going to get you fixed and this is how you look after it. But absolutely, yes. If you want some maintenance, I'm here. You know, I'm a mechanic. You put your car in for service every year, you spend £800. Why not spend a few hundred on your body? So it is a different model to the NHS system. You don't want reliance. You don't want all these people just sucking the system dry because they've got chronic pain. But it's the demographics are completely different in some cases. But for me, yeah, focused, I think, will only keep getting more and more powerful. Radial, I think, will definitely be there as a second. But then you've got laser, you know.
Laser's been around for a long time.
It has, you know, but now you've got these stronger lasers.
Yeah.
But are they just doing things that ultrasound used to do, which is thermal heating, cellular activity? You know, there's ultrasound work. I've used it for years. You know, haven't used it for probably a while, but it's still outside my door. And if I've got something where I think, do you know what, for 3 minutes, I've got a bit of time, whack it on. You know, get it up to 1.6 watts per centimetre squared, get a heat into an area, make it more pliable. It's gonna, you know, it's all about loading, isn't it? But reduce pain.
And I think that's why it kind of all comes back to, and we have like a soft tissue management model, where everything that we do, whatever therapeutic intervention you put in, it's all underpinned by movement and load, all of it, even during treatment. Like I do sometimes shockwave treatments. I'll have somebody under isometric load. So if it's the bicep, might even get into flexion, might get them into abduction. Even actually getting them to move through range while I'm delivering the shockwave treatment. That's more like sort of end stage, but it's movement and load, and it's definitely the biggest part. And I know there's a few people on with radial shockwave as well, and it's like, you know, focus did come first. Radial was the offshoot off of it. However, radial, when you combine focused and radial shockwave, I think there's a lot of benefit there in terms of within treatment, but there's not enough papers that actually look at both of them together. They compare one versus the other, and it's a bit of a frustration of mine, because like I would like to see a couple of combination treatments, because like you mentioned from the start, they are fundamentally two different therapies, and one's a pressure wave, one's a shock wave. If I kind of give a comparison, it's like diagnostic ultrasound, sorry, and MRI. They're diagnostic imaging, but they give you two different things, and two different images. So it's like there might be some scope there. But I mean, I think when you look at both technologies, there are thousands of papers, thousands of them. There's not enough time in the world to go through all of them. So I think there's plenty of evidence behind it. And I mean, from the business perspective as well, if you can offer a new or a modality, like you say, if it's therapeutic ultrasound, then it's like, I've got a few minutes, and if you can increase a bit of blood flow and pliability, and it helps the patient, great. And I think shockwave has been one of those over the few years. Controversial, I think, and it depends on who you speak to, but I think that's just therapy generally. But I think it's definitely got a place. Focused and radial have got a place, and I think both. I mean, well, you're definitely an advocate that it definitely generates revenue.
I think actually, if you look at the maths, being the geek, is you could argue that radial could be more profit generating, because let's say with the VAT, let's say it's $7,500, so it's 4 times, or just under, give or take, but 4 times cheaper than a focus unit. So let's say I'm charging £50 a bolt-on for focused, and I'm charging £30 a bolt-on for radial. My profit line actually is almost 100% more with radial. Yeah. For the outlay. So as a business model for someone starting with reducing your risk, and because focus is a big outlay, there aren't many clinics that suddenly have 30 grand that you want to just go, I'm going to buy one of those. So I think in that front, radial gives a lot of value. It's just, are you going to be able to give the same guarantee about the pain relief, about getting them to a point where they can load? I did watch a guy last week, and I'll tell you, his session was painful. I mean, he was in pain, but he loves it. He comes back every month to this clinic, and he has it, and for him it works, and he's quite happy to endure 5 minutes of pain. And they do shockwave clinics, so for like 20 quid, they pay a sports therapist to deliver shockwave every 15 minutes. You've got lots of options, I think, with radial, which are the big pluses. The focus has big pluses, but it also has the negatives of the financial bits to it.
Yeah, and it's weighing it all up, isn't it, really, and just figuring out what's best, because it's also, you can buy things outright, you can stick things on leasing. I mean, the leasing perspective, obviously speak to your accountant about how it works with the tax side of things, and even our leasing partner, Complete Leasing, they're really good at being able to advise about the tax benefit of spreading costs. Obviously the caveat to that is you pay interest, and like you say, it might be better getting a personal loan. There's all those kind of things. Ultimately, obviously, it comes down to that financial aspect. We're here to always help. You mentioned before, like if somebody is finding that they're not getting the most out of their shockwave, we will always try and help. So if somebody says, I'm not getting the most out of this, and it could be 6 months, 9 months, I'm clinical apps. So I take it kind of like, I need to help you, because my job is to help people implement it and apply it into their clinic. And we've done open days before. We've done sessions where I will go in, with that person, line up some patients. We might just do like it's a freebie afternoon, line up some patients, build up their confidence, do a little bit of marketing, video, all that kind of stuff. And as you'd expect, we provide all your imagery and your website templates that people can use as well. So it's like we always want people to be successful, and it's a last resort if somebody's like it's just not working. We do want to make sure that people, because it does work. I've seen it, hundreds of clinics in the UK that use it. So the last thing I just want to sort of mention is just like you say, it's worth considering the ongoing costs. And the running costs, and whether it's Shockwave or any machine, looking at servicing, consumables, training costs. One of the things I've found, or our engineer found out recently, is that make sure your servicing covers the machine and the handpiece, because they can be priced differently. All our services cover both in one price. So is that something that, obviously, when you mentioned about the consumable side of things, I know there's not much with Physiowave. Is that something that you took into consideration as well?
Yeah. I mean, the main we looked at one unit, and it was like, you were paying like I can't remember if it was a monthly fee or if it was an annual fee. I can't remember what it was, but it actually worked out significant costs. I'm not talking like a few thousand. Whereas your one, it was, well, this is the cost of the machine. This is how many shocks we know we'll get out of it as a guarantee. So a minimum, but actually you may get a lot more out of it. So you can then go, well, that is in effect X number of treatments. If I charge it at X amount of money, it's going to pay me 2 times the machine cost or 3 times the machine cost. So the only cost we've got, obviously, make sure your staff fully understand the cost of the items. We had someone throw one of our heads away. So that's now cost us £500 to replace. A bit frustrating. So that is a negative of a big team. The more people that use it, they don't own it. It's not theirs. They don't care as much as you care about it. And that is that was a cost we didn't foresee. But the running costs with yours are low. They're the lowest I found.
Yeah. I think the easiest way that I kind of figured it out, and I think we did it with yourself as well, Geoff, is just whatever you're spending, and this could be radial or focused, whatever you're spending on the device, let's say it's 25,000, divide that by how many shots you're guaranteed. So let's say it's 3 million, divide that 25,000 by 3 million, and that'll give you a cost per shot. And then you can figure out how much average treatment's 2,500, I would say, roughly, per treatment. Just times that cost per shot by 2,500, that gives you a cost to run the system. That's the minimum you'd have to charge to break even within that shot guarantee.
So I think doing the maths on
that. So I think if you take ours as like 25,000, divide it by 7.5 mil, and then that's times by 2,500, it works out about £7 a treatment, £8 a treatment.
Yeah.
So you to make your money back inside the 7.5 million, you only have to charge a patient essentially an extra £8. So if you charge 20, 25, your margin on that essentially is quite a nice, healthy one. So it's these are all things that we can help with as well. Geoff, I'm just looking at time because I know I could talk all evening about this. So
yeah, go for it.
Is there anything else that you'd like to mention? There's no other questions that have come in.
No. I think just it all depends on where you're at in your clinic journey, number of staff you've got, disposable income, or if you haven't got any disposable income, can this make you some extra income, and how do you do that? They're the main takeaway points.
Sure.
And if in doubt, go focused.
Perfect. Right, Geoff, thank you very much for your time. For everybody who joined us live, thank you very much for joining us live as well, and for your interaction as well. For those watching the recording, again, thank you for your time watching the recording. Geoff, it's been a pleasure having you on again. I'm sure we'll do another follow-up one at some point in the future.
Yeah.
If anybody has got any questions, any feedback, then please send it in. Our email is info@physiequip.com. We've obviously discussed a lot about the business side of things around Shockwave. Advice is completely free from our perspective. So if you've got any questions about Shockwave, doesn't necessarily have to be about our system. You could already have the Shockwave in place. Always here to advise. Or if you're looking at adding Shockwave to your practice, give us a call, find out how much things are, and we can figure out what return on investment models could look like for you. Other to that, if you want to have a look at any of our other webinars, PhysiQuip Academy is the place to have a look at. We've got things on diagnostic ultrasound, as well as sort of movement analysis and a few other aspects as well. Other to that, we'll shut up, say good night to folks. Enjoy the lighter evenings. It's much nicer when it gets to the summer. Once again, Geoff, thank you very much for your time, and we'll see you soon.
Yeah, cheers, guys.
All right.
Take care. Speak to you soon.
Bye.